Hello everyone. Today, we will learn about the topic, what should you not eat during pregnancy? A proper and scientifically balanced diet during pregnancy plays a crucial role in ensuring the health of both the mother and the baby. However, in addition to the necessary supplements, pregnant women should also avoid certain types of food, as they can be the cause of miscarriage or stillbirth. So, what should pregnant women avoid eating? What should pregnant women not eat during the first 3 months? The first 3 months of pregnancy are the most crucial period for the fetus, as this is when the baby's organs and nervous system begin to form. Therefore, the nutritional regime during the first 3 months of pregnancy is a determining factor for the baby's weight and future development. Besides, during the initial 3 months of pregnancy, mothers face various risks such as miscarriage and stillbirth. Hence, special attention needs to be paid to the diet during this period. To answer the question of what not to eat during the first 3 months of pregnancy, doctors recommend that pregnant women avoid the following foods. Sprouts. Sprouts, such as bean sprouts, always harbor bacteria in the seeds before the sprout grows. Pregnant women should absolutely avoid eating them raw. They can be consumed if cooked. Deliberate consumption may introduce bacteria into the body, potentially causing deformities in the fetus. Salty pickled foods. Pickled foods like pickled cucumbers, pickled tomatoes, etc., are often fermented by microorganisms. During the fermentation process, nitrate is converted to nitrite, leading to a high nitrite content, which is harmful to the body. Seafood. Seafood is rich in protein, but some types of fish, like king mackerel, shark, tuna, swordfish, and tilefish, especially larger and older ones, may contain high levels of mercury. Therefore, the answer to the question of what not to eat during the first 3 months of pregnancy is that pregnant women should avoid these types of fish. Various beverages, herbal tea, carbonated drinks, alcoholic beverages, coffee, etc., not only impact health, but also pose a risk of congenital abnormalities to the fetus, increasing the risk of miscarriage. In addition to the mentioned foods, some vegetables like spinach, coriander, and beets should be avoided during the first 3 months of pregnancy to prevent the risk of miscarriage. These foods contain substances that stimulate uterine contractions, increasing the risk of miscarriage for mothers. What not to eat during the last 6 months of pregnancy? As the fetus stabilizes, the last 6 months of pregnancy focus on weight gain. By the 4th month, pregnant women often experience a reduction in nausea symptoms, leading to a better appetite and cravings for snacks. Therefore, during the last 6 months, pregnant women need a balanced diet to prevent excessive weight gain, blood sugar disorders, and hypertension leading to preeclampsia. Some types of food that pregnant women should avoid during pregnancy include 1. Sweets. During pregnancy, the kidney's ability to excrete sugar decreases. Consuming excessive sweets can elevate blood sugar levels, overloading the kidneys and being detrimental to health. Additionally, some studies suggest that excessive sugar intake weakens the body's immune system, increasing the susceptibility to diseases and infections. However, moderate amounts should still be consumed based on daily body requirements. 2. Excessively salty foods. The incidence of high blood pressure is related to the daily salt intake. Therefore, if pregnant women consume excessively salty foods, there is a high risk of developing hypertension. This is also one of the reasons causing pregnancy-induced hypertension in the last 3 months of pregnancy. To ensure health during pregnancy, expectant mothers should consume about 6 grams of salt per day. 3. Fish with high mercury content. Tuna, mackerel, canned fish, etc., are foods that contain high levels of mercury. Regular consumption can lead to mercury accumulation in the body, causing damage to the nervous system and fetal development. 4. Raw or undercooked meat and fish. Beef tartare, sushi, and raw fish all carry bacteria such as Salmonella, Toxoplasmosis, coliform, leading to food poisoning. 5. Grilled and smoked meats. These foods, known for their delicious flavors from grilling with charcoal or burning materials, produce toxic substances that can contaminate the food and have the potential to cause cancer. Therefore, pregnant women should limit the consumption of grilled foods to ensure the health of both the mother and the baby. 6. Processed meats. Processed foods like cold cuts, pastrami, sausages, etc. carry the risk of containing Listeria bacteria. Pregnant women face a high risk of miscarriage if infected with Listeria. Therefore, pregnant women should avoid these types of foods. If they want to change their taste, they should prepare and cook them thoroughly. 7. Animal liver. Animal liver is rich in iron and vitamin A. However, during pregnancy, pregnant women are already supplemented with iron and absorb vitamin A from synthetic vitamins. Therefore, frequent consumption of animal liver will lead to excess iron and vitamin A, negatively affecting the fetus, possibly causing fetal malformations. 8. Unpasteurized milk and dairy products. Most types of milk are pasteurized and provide ample calcium and vitamin D for optimal child development. On the other hand, some unpasteurized products like feta cheese may contain Listeria bacteria, negatively affecting the health of the fetus. 9. Raw vegetables. Raw vegetables often carry a high risk of contamination with bacteria such as E. coli, Salmonella, causing food poisoning. Pregnant women need to avoid these types of vegetables. In addition, watercress contains papaverine, which has the effect of relaxing smooth muscles, reducing blood pressure, and relieving pain. If pregnant women consume many of these vegetables, the cervix may contract, increasing the risk of miscarriage. Bitter melon contains monodicin, quinine, which stimulates uterine contractions, increasing the risk of miscarriage. Therefore, pregnant women should avoid eating bitter melon. In addition to the mentioned foods, fresh bamboo shoots are also a food that pregnant women should avoid, because they contain cyanide, a dangerous substance for the body. Pregnant women may be poisoned if they do not remove this toxic substance before eating. Symptoms may include nausea, headaches, difficulty breathing, and in severe cases, death. 10. Certain fruits. Although fruits provide many vitamins and minerals for the body, some types of fruit may adversely affect pregnant women, such as green papaya, pineapple. They contain substances that stimulate smooth uterine contractions, which can lead to miscarriage. Lychee, jackfruit. They contain a lot of glucose. If consumed excessively, pregnant women may have a high risk of gestational diabetes and constipation. Therefore, pregnant women should limit the consumption of fruits with high sugar content. In conclusion, focus on consuming a balanced and nutritious diet during pregnancy to ensure your and your baby's health. Limit the above foods for a safe and healthy pregnancy. Once again, thank you so much for watching this video, and I'll see you in the next one. Take care, and have a fantastic day.